Okay, hi, we're going to talk about, is fiber the most common dietary deficiency? Fiber in food is really important and it's really good for you. Okay, so the first thing I'll just mention is tons of people, I can tell you most people over 50s nowadays, they're overweight, often obese, diabetic, fat and sick. And the typical ignorant person that doesn't know anything about nutrition is always like, where are you going to get your protein? I got to get my protein for the day. Don't worry about protein. You can't have too little protein. Okay, we talked about this in some other lecture, but basically, human only needs about 4% of their diet in that ballpark of protein, maybe even 3%. Okay, human milk is only about 5–6% protein. Everybody's eating almost everybody's eating way more protein than they need. Forget about it. To me, it reminded me, these are people who are fat and sick, 100 pounds overweight, 1, 2, 3 types of cancer, diabetes, myocardial infarction, stroke, all these terrible problems, okay? And they're worried where they're going to get protein. They remind me of mice with a toxoplasmosis brain parasite that thinks cat piss smells good, okay? I talked to some of these guys, they love ice cream more than they love anything else. It's ridiculous. Forget about protein. That's not their problem, all right? The main problem in dietary deficiency these people have is a lack of fiber. Fiber comes from plant food, and the reason is every plant stabilizes its cell wall, its individual cells, with fiber. That means cellulose, okay? It's an indigestible carbohydrate, but just think of it as fiber. And the point is that fiber feeds the good bacteria in your colon, so they make butyric acid to make the tight junctions of the enterocytes, so you don't get leaky gut and all that. But in addition to that, fiber causes water to be added to the stool. There's still described two main types of fiber, soluble fiber and insoluble fiber. Insoluble fiber especially is the one that helps add watery bulk to your stool. Soluble fiber is especially the one that feeds your good bacteria in your colon. Other points. The same patients that are always worried about getting their animal protein, and that's a big part of what makes them fat and sick. They're in love with the foods that make them fat and sick. That's why these patients never get better. There's sort of this fairy tale version of health that, everybody's doing okay, healthier than ever. No, people are fatter and sicker than ever. There's more obesity, more diabetes, more cancer than ever before, okay? So that's an important point. You're screwing up, okay? If you're fat, that means you're doing something wrong. It doesn't mean you're genetic. If everybody in your family is fat, you're probably all eating the wrong stuff, okay? Don't blame it on genetics. Once you blame something on genetics, that's like saying, I'm screwed, there's nothing I could do, this is my fate. No, you say to yourself, well, gee, I look all over the world and there's tons, there's millions, there's billions of skinny people. I'm going to try to learn from them and be like them, and then I'll be skinny too. And the reason you want to be skinnier is because fat people get all the fat people diseases. Diabetes, hypertension, coronary artery disease, myocardial infarction, stroke, Alzheimer's, etc. It goes on and on. Kidney failure, kidney stones, etc. Okay, how many times should you poop every day? You should defecate at least twice a day. If you're not defecating at least twice a day, you are constipated. Really, it's normal to defecate after every meal, and sometimes throw some extra ones in there too, but you should normally defecate a minimum of 2 times per day you're constipated. You don't want to be constipated, because if you're constipated, that means you're at risk for abdominal pressure syndrome, which we're going to talk about in just a moment here. How much fiber should you eat every day? You should eat a minimum of 40 grams of fiber in your food every day. And it's best to get it from your food rather than take it as a fiber supplement. Just the process of your intestinal tract removing it from the foods that you eat is good for you. And you actually ideally should be eating over 100 grams of fiber per day. It's, Dr. Dennis Burkett, he's the guy who figured out a lot of the original data on fiber, and he recommends people eat 100 to 150 grams a day. I eat routinely at least about 105 or more grams of fiber a day. I'm a 100% plant-based diet person. Okay, Dennis Burkett. Who was Dennis Burkett? He got named as the fiber man. He was a physician. He's a real interesting guy. He sort of started out his medical training in Ireland. Then he went to England. He was trained as a surgeon. Then he was doing missionary work, and he went to Africa. He was the guy who discovered and described Burkitt's lymphoma. In the process of describing Burkitt's lymphoma, which was a hot topic back in those days, let's say in the 1950s, because it appeared to have a correlation with a virus, and the idea of a tumor virus was a fascinating research topic at that time. So Dennis Burkitt got put in charge of most of the epidemiology of the hospitals in Africa back in the 1950s and 60s. And he also observed different patterns of diseases, and he had a partner named Hugh Troll, MD, and Peter Cleve, MD, and they were both having theories about what causes disease. And Troll's theory was it's primarily due to a lack of fiber. A lot of these modern diseases, like we talked about, diseases of affluence, the ones we just described. And Cleve mainly thought it was excessive dietary intake of sugar. Meanwhile, at the same time in the United States, there was Nathan Pritikin, who's a genius. Man, you want to see somebody who's really interesting? Study Nathan Pritikin, okay? He basically cured himself of heart disease. Fascinating guy. I know there's videos online about Nathan Pritikin. All right, so anyways, getting back to those guys. So Nathan Pritikin's big thing is fat is bad, all right? I would agree with that. I don't think there's any good fats. That whole good fats, I think, is like this Trojan horse slogan that gets gullible people to eat all kinds of junk food and make themselves fat and sick. All right, so Dennis Burkitt, fiber man. What did he do? Dennis Burkitt, he then traveled all over Africa, drove over 10,000 miles in his Jeep. He would literally study stool samples, and he would study all the epidemiology cases in these hospitals, and he would correlate what diseases patient had with what type of lifestyle and diet that they ate. And what he found out was people eating old-fashioned diets, like eating a lot of rice and a lot of beans, a lot of sweet potatoes, they almost never got these typical diseases of affluence: obesity, hypertension, coronary artery disease, constipation, and whatnot. Okay, whereas a lot of times the wealthier people who were eating more of the refined flour, more sugar, eating more meat and oils, they would get all these diseases. So I'm going to now go into a drawing of this. So here is supposed to be your abdomen. We'll draw these lines for the right upper quadrant, left upper quadrant. It's hard to fit it in here, but call that the right lower quadrant, and that being the left lower quadrant. So that's how we draw an abdomen in medicine. You know, the subcostal margin of the ribs defines the upper quadrant of the abdomen. So this is right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. All right. When you're straining at the stool because you're constipated, by the way, I wrote this on the other side, a good poop should be a lot more like a cow patty than like a goat pellet. It should come out kind of nice and soft. Okay, that's a good one, all right? When it's coming out goat pellets, that's a sign that there's a problem. You're constipated. All right, so when a person's constipated, the straining at the stool, not good. The back pressure is transmitted to the rest of the bowel. Back pressure to the sigmoid colon will cause outpouching, these little diverticuli. Just diverticuli by themselves are called diverticulosis. If one of them pops, then it's called diverticulitis. And those can be very painful. It's a very common cause of abdominal pain and admission to hospitals. And I can tell you, most people over 50, I don't know, I'd say more than half of them that I see, they got diverticulosis at least. And it's very painful, and it can be treated initially with antibiotics. If the perf causes an abscess, then you got to do a catheter drainage. And if it's a recurrent severe problem, you have to take this part of the colon out. No fun getting your sigmoid colon taken out. There's often a temporary diverting colostomy, often reversible, but not always. All right, what else happens? When your stool is dry, normal person eating a good amount of fiber, they got liquid stool on the right side of their colon. Because it's liquid, it moves along pretty nicely. It doesn't plug things up. When the stool is dried out and the colon transit time is slow, there's a tendency sometimes to form a pendicolith. Lith is like the medical word for stone. A pendicolith is a stone in the appendix. That stone will block the appendix. The glands beneath there, mucus glands, will continue to secrete fluid, which then is obstructed by the pendicolith until the appendix gets stretched and distended, and then it pops and it starts to leak stool into the belly. That's what appendicitis is. That would be a perfed appendicitis. When it's just big but not perfed yet, that's an appendicitis before perforation. Ideally, you take it out before perf, or if you have a localized perf, it's not so bad. But if that stool spills all over the belly, then you'll have tons of abscesses. I've had patients I had to drain abscesses in 7 different locations after they've got a perfed appendicitis. Also, you know how you can check your transit time is beet juice. So here it is, beet juice. Drink some of that beet juice, and then you'll notice it doesn't show up in your poop for another day or 2 days, and then you can see how long it stays in your poop. That's your dietary transit time from mouth to anus. And I can tell you something, the longer it is, maybe you got a constipation problem, you're not getting enough fiber. It's a cheap way to test it. All right, abdominal pressure syndrome is these constellation of findings that people get. And Dennis Burkitt is the guy who figured this all out. That's why he got nicknamed the Fiber Man. All right, so anyways, we talked about straining at the stool causing diverticuli that can perf, diverticulitis, the dry stool on the right side becoming hard and forming a stone, appendicolith and appendicitis. Also, you can strain and cause back pressure leading to dilatation of the veins around the anus. These are called hemorrhoids. An external hemorrhoid sticks out your butt and it can bleed, and people could see it. Internal hemorrhoids inside it, you don't see it, but it could potentially bleed. Also, that back pressure is transmitted. The abdomen is a compartment, and when you increase the pressure in the abdominal compartment, it pushes on the leg veins. And that's an increased cause of varicose veins in the leg. So being constipated can cause varicose veins in the legs. In addition, straining at the stool will cause, the abdomen is connected to the inguinal canals which go into the scrotum. It can cause back pressure on the veins in the scrotum. When the scrotal veins dilate, that's called a varicocele. The varicoceles can lead to infertility in men. They can also lead to chronic discomfort in the scrotum. You know, I told this one guy, you know, that's what appears to be the cause of abdominal pressure syndrome. He said, "You telling me my balls ache because I'm constipated?" And yes, it's true. That is a reason why somebody's balls might ache. It can also cause spermatocele cysts in the scrotum. Then the other thing, very common, is the back pressure in the abdomen from straining at defecation can lead to the stomach pouching up above the diaphragm. So here's the diaphragm that separates the chest from the abdomen. And part of the stomach will pouch up. Usually it'll be a small hiatal hernia, but they're associated with gastroesophageal reflux disease, meaning that stomach acid can extend up into that area, and it can cause irritation of the lining of the stomach. And that can cause gastric ulcerations, peptic ulcer. It can also, very often, changes the lining of this to something called Barrett's esophagus. And Barrett's esophagus is sort of an inflamed type of change in the mucosal lining that increases the risk of cancer. Esophageal cancer, back when I was a young guy training in medicine, was most commonly, we thought of it as smoker-drinker cancer from tobacco smokers and alcoholics, or just people drinking a moderate amount of alcohol were getting that esophageal cancer. Nowadays, there's more esophageal cancer, sort of an adenocarcinoma type, from just this gastroesophageal reflux. Hiatal hernia, gastroesophageal reflux, super common, okay? And sometimes these hernias are really big and they even compress the heart or they need to be surgerized. No fun. So anyways, the smart move is get your fiber. Fiber comes from plant foods because all plants have fiber in their cell wall to stabilize and rigidify the membrane. Animal cells, in contrast, they rigidify their cell membrane with cholesterol. That's why animal foods all have cholesterol. That's why plant foods don't have cholesterol. So anyways, that's our summary of fiber, and you should be having at least 2 poops a day. Get a minimum of 40 grams of fiber a day. Look at all your foods. Look at all the labels. Look at the stuff you eat, and then you'll read, like, there'll be some food, like, say, your beans or something that you don't know how much fiber. There's nothing on the package, but you could read average amounts for the different thing you eat, and you'll figure it out. It's not that complicated, and I hope that is helpful.